Good afternoon, everyone, and welcome to our monthly All In for Kansas Kids Systems Building webinar for February 12th, 2025. My name is Julia Gruss. I am a research project coordinator at KU Center for Public Partnerships and Research, and will be your webinar facilitator for today. I also have my colleague, Brianna Houston, who will make sure that any links that you are seeing or QR codes that you are seeing on your screen throughout today's presentation, that she drops those links in the chat as well to just be easily accessible in case you don't have your phones handy. So real quick, our 2025 webinar series is kicking off today. We had the month of January off to give everybody a little break and the ability to kind of plan for the new year and get settled back in. We are holding these webinars still on the second Wednesday of the month. If anybody has had an issue getting the webinar added to their calendar, you can send me an email at jgruss@ku.edu. I can have Bree put that in the chat, but I think at this point, everybody has gotten those Zoom confirmation emails and has gotten the 2025 webinar series added to their calendars. And as always, please sign up for our weekly All In for Kansas Kids e-newsletter. You can do so by going to the Children's Cabinet website at www.kschildrenscabinet.org. You will get weekly updates on the early childhood system in Kansas, so it's always good to stay on top of things that way. We have a couple presenters with us today, starting off with two of my colleagues from CPPR, Kayla Byers and Jared Barton, are going to be giving a presentation on building systems for family well-being, talking about the Family Strong and the Family First initiatives happening in the state. And then following their presentation, we have Sharon Field from Kansas Child Care Training Opportunities, who is going to give us some information on the Individualized Personal Development Plan, also known as the IPDP. And then after our presenters are finished, I just have a few events, early childhood systems updates to give you, and we can send you on your way this Wednesday. So without further ado, I'm going to pass it over to Kayla to get started on their presentation. Thanks for being here.
Wonderful. Thank you so much, Julia. Really appreciate the opportunity to be here with you all today. I'm Kayla Byers. I'm an Associate Director at the KU Center for Public Partnerships and Research. And as Julia mentioned, I'm joined by Dr. Jared Barton, who is the Director of KU Center for Public Partnerships and Research. And we are going to share a couple of initiatives around building systems for family well-being, specifically Family First and an initiative in Southeast Kansas, Family Strong. So again, we're going to highlight from these two initiatives. And I'm going to start with talking about Family First and really the power of prevention and those investments upstream in helping children and families meet their needs and be stable in their homes and communities to prevent longer-term outcomes that we know are associated with adversity in early childhood and throughout the life. And those early investments have impact, and I'm going to share some of those today so we can see how that works as a mechanism for supporting children and families. So I'm going to talk about the Family First Prevention Services Act, which is implementation by the Kansas Department for Children and Families of a federal legislation supporting primary prevention efforts in communities. And that started in 2019 and is an ongoing initiative. So Family First allows foster care dollars to be spent on community-based prevention services for children and families who are at risk of removal from the home to foster care. And this legislation allows funding for 4 different types of services: mental health, substance use disorder, parent skill building, and kinship navigator programs. The programs that are available and approved for federal reimbursement under this program must be trauma-informed, they must be evidence-based, and provided by a qualified clinician. Our Kansas array is a mix of many services, and I'll show that in just a moment, but really intended to meet the local service needs and within these 4 categories. So here you can see the Kansas Family First Service Array. Two things here that you're looking at. First is the map, which you can see all the little dots in every county, all the 105 counties in Kansas. Those are representing Family First services that are in place in those counties. So every county has some array of Family First services, though not all services. And DCF has maps available, and we can provide that as a follow-up here that provides the specific regional level services. But you can see here on the right, these are all the services that are within the Kansas Prevention Plan that it governs Family First implementation. So there are a number of services that are substance use related, mental health related. We have a number of parent skill building programs. Many are home visiting programs, such as Healthy Families, Parents as Teachers. We also have preventive legal services under our kinship navigation, and that's through Kansas Legal Services, and then some other family advocacy programs. This array was selected by DCF after a listening session across the state, and then some ongoing work that I'll speak to. But this is what's currently available and where those things are available. Next slide. So, as I mentioned, this has been an ongoing initiative since 2019. Kansas was an early adopter of this approach in primary prevention. And so this law was passed in 2018. We were one of the first 5 states to have an approved plan. And so DCF has asked for an evaluation because they're interested in understanding what is the impact of this full array of prevention services that are delivered within the community under this new initiative. What is the uptake and implementation? What does it look like in practice when we are building this new system of support? What is their experience of it? How do providers experience that? So that's something we're trying to understand. And then also, what are the recommendations that come out of that understanding for how we can make this better? This was a landmark piece of legislation that really opened up primary prevention funding in a new way. And so establishing that evidence of does this work and how is really important, and then feeding that back so that we can make it better across all 50 states, but specifically for our families here in Kansas. So you can see here, this is a little bit of what we're looking at in terms of understanding the impact of Family First. We want to know how does receiving these services change things for families? What are they experiencing as an impact? And then also, how does that prevent removal into the child welfare system, which is really our aim, is to wrap around families upstream before their problems become major crises that require us to get involved later in the system and end up in a removal, which is traumatic for the family and maybe could have been prevented had we intervened sooner. So that's really our aim here, is to understand that and to increase family functioning in terms of their well-being and reduce that child welfare involvement. So what I'm going to highlight for you quickly today is a little bit about the program reach, how much this program has spread and is reaching families across the state, and then also a little bit about the impact both to families and to our systems. Next slide. Okay, so in terms of reach, family, like I said, we've been in up and going for about 4 or 5 years now. Family First services and programs have reached more than 6,600 families across the state, which is a really big footprint. That's a lot of families served. And we're serving families across every region and across every service type. So you can see here those numbers. The biggest need across service types has been for mental health services, with 40% of the referrals of those 6,600 families going to mental health services. And that's followed by the parent skill building, so the home visiting and other types of parenting skill programs that are available. And then the preventive legal support, which is oftentimes establishing guardianship and those sorts of things, expungements, things that will help families stabilize. And then other prevention services, these are some of those that don't really fall under those buckets. And then you can see across regions, there is reach of these programs and referrals happening across every region of the state. These are the DCF regions, with Wichita receiving the highest proportion of referrals, with nearly a third of the referrals happening in the Wichita region, but then pretty evenly distributed across the other regions. So, just a little bit about impact on child and family well-being. So, we've reached 6,600 families over the last 5 years with this program. What are we seeing? And we're seeing great things. So, one thing that we're seeing is that there are significant improvements among families who complete services across several areas of functioning. We are measuring child social emotional functioning, caregiver mental health, both in terms of depression, anxiety, and stress, caregiver sense of their parenting skill, their own competence and confidence in their parenting, and caregiver substance abuse. All of those measures are showing statistically significant improvement from the time of referral to the time of service completion. So families who are getting and completing these services are having increased protective factors and decreased risk factors. Um, Families who receive Family First services are also really likely to stay together in the home. We looked at Family First services as compared to other prevention services in the state and found that Family First was the most likely to result in the family staying within the home. Other prevention services are also highly predictive of keeping families safe and stable in their home, but Family First, because it's so far upstream and intended to serve families before the crisis escalates, has the highest probability, with a 97% probability that families would stay in the home, and that's higher than all the other programs. And of the families who have received the service, 90% have stayed after 1 year of service, or 1 year after the referral, are still together safely in the home. So we are improving protective factors, reducing risk, and also keeping families safe and stable in their homes, in their communities, without the need for foster care. In terms of impact on service array and access, this has been sort of a parallel piece. I mentioned wanting to understand the outcomes, but also how does this implementation work, and is it working for and with families? So Family First is overseen by two oversight bodies. So the Family Council, which is a council of lived experts who have experienced the child welfare system either as a child, as a parent, or otherwise, and also the Interagency and Community Advisory Board, which is made up of state agency representatives, community sector representatives, and the lived experts from the Family Council. And both of these bodies are really tasked with overseeing and understanding the impact and making recommendations across all the systems of ways to strengthen this service array. And through that work and understanding the impact of Family First, these councils have been able to make recommendations over time to refine the service array and what's offered, and to help DCF really understand and support this program better. And so they've made some changes in terms of the implementation as a result of the recommendations from providers, the recommendations from families and others. That's resulted in introduction of new services and new processes. And then also, really importantly, the plan, the statewide prevention plan, is a 5-year plan approved by the federal government, and that really is the governance of Family First in the state. And that 5-year plan is expiring and needs to be renewed. As part of that process, DCF invited these groups, particularly the Family Council, to help craft the new vision for the renewal. And the plans that were drafted, the recommendations made, once the plan is renewed, the plan is to integrate those recommendations from the Family Council through modifications to the plan over time and scale those up. And that includes new services, that includes a new pathway for accessing these services to make this more community-based and family-friendly. So those voices in the community are really able to help shape this program, this impactful program that we're already seeing effects in, shaping it to be even more impactful, more family-driven, and upstream in the community to provide that support. So that's some of the impact that we've seen. In terms of next steps, we will continue to support the delivery of Family First statewide and conduct our evaluation. We are also layering on a new needs assessment. I mentioned that the service array was developed through understanding of listening sessions in the community. We're currently taking another look at the service array and at the community landscape and the needs of Kansans, to understand, is the array that we currently have what we need, and are there changes that we should recommend? And that will come with feedback from families and from providers and all different types of data. We are also renewing the prevention plan, as I mentioned, as a next step, and really integrating those family council, provider, and ICAP guidance and recommendations, and then also contributing these learnings to the national landscape, sharing this out with other states and other implementation teams and evaluators, decision makers. As I mentioned, this is a new policy, and understanding what it does, what are some of the shortcomings, what are things that we can shore up in the policy. Some of our early learnings as an early adopting state will help shape that going forward. And so we have a real voice in saying, hey, this is what's working for us in Kansas, and here's maybe what's not. And so that's part of the conversation going forward. So that's family first. And now we're going to shift to talking about family strong and the power of community. And this is a little snapshot of a demonstration project that we have, that's being administered in Southeast Kansas, and we'll share more about that. But this is the highlight that we're going to share is really sharing how the voices, perspectives, and priorities of families and communities can be a driver of systems change, that they can be what shapes what we know, what we do, and how we do it. So Jared's going to share a little bit about what we're doing in this initiative to help shape systems and services from the perspective of community voice. So Jared, I'll turn it to you.
Thanks, Kayla. We can jump to the next slide. I think something that you'll likely hear, hopefully reiterated throughout this, is that kind of that last point that Kayla made as we're talking about Family Strong and what we're doing to be very intentional about trying to have like meaningful engagement with communities, having their voice, having them help shape, drive the work that we're doing in the community, how we're understanding what's emerging from the work that's happening as a result of Family Strong in the community, and really try to promote and amplify the fact that the individuals and the communities that have lived experience in those areas are truly best positioned to help us understand what their needs are, what their values are, pathways to improving well-being in those communities. And that's at the heart of the Family Strong goal. So Family Strong, as she mentioned, is really aimed at demonstrating how community-based systems can work together to promote child and family well-being, and as a result, promoting the well-being of the full community. It's currently, so as a demonstration project, this is kind of a uniquely constructed initiative that we're trying out for the first time. It's currently implemented in an 8-county area in Southeast Kansas. And that 8-county area was selected for a variety of reasons that extend from, just a number of poor social, economic, and health outcomes in the region, but also because it's been described by individuals in the area. Again, their kind of words in helping us make meaning of what's happening in the community. It's been described by individuals there as a resource and opportunity desert, having a culture of someone phrased it as toxic independence. So in other words, there seems to be a general acknowledgement in the area and the community that all of us, no matter who we are, need the help of our community and our social supports, but that seeking help isn't always for me as the individual. It's for someone else, even though we all could benefit from it. So those are some of the reasons that it's targeting this particular area at this time, to take kind of a strengths-based approach to this. So despite some of these challenges and these circumstances that have been identified here, one of the reasons that this demonstration is possible and set up for success to occur in Southeast Kansas is that there is an overwhelming will in the community to solve some of these problems, to solve some of these issues. There's a strong community there that's facing these challenges and these circumstances, and there's already quite a bit of infrastructure when it comes to service coordination, different service providers that are in community, more kind of like holistic or community-based approaches to the work and supporting children, families, and communities is already happening there in Southeast Kansas. So it's really Family Strong can come in kind of on top of that, overlaid with all of it, and support those systems, strengthen those systems for the benefit of the whole community, and hopefully help us understand how initiatives and demonstrations like this could transfer to other places and promote well-being on the basis of communities' voice and how it works in Southeast Kansas, potentially informing how it could be approached elsewhere. Next slide. The Family Strong demonstration, just like with Family First that she described, involves a fairly sophisticated evaluation of what's actually happening in the community. And that's to determine the research questions around what are the essential elements of a community system of well-being? What does that look like in Southeast Kansas? And how does designing programs, community services, and universal supports in the area help impact our desired outcomes for improvement in the area. Those desired outcomes include improving protective factors, increasing connections across the community service array, increasing family referrals and access to services and resources, so strengthening those referral networks across the community. And then, like Family First, reducing unnecessary involvement in the child welfare system. So supporting children and families and communities where they are with the things that they need in an effort to prevent unnecessary removals from the home, unnecessary involvement with state systems, and valuing and keeping families and communities intact as much as possible. We're using a variety of methods to do this evaluation. So it includes a number of quantitative and qualitative initiatives to do this evaluation, and understanding protective factors, understanding well-being, data from state and administrative sources that we're integrating to help us understand how Family Strong is working. But as she mentioned earlier, really what we're highlighting today is one particularly innovative evaluation method that we're using, and really just kind of meaningful community engagement method that we're using, and that's around collecting stories from folks in the community to get an understanding of what their experiences are, and then hosting local sense-making sessions within the community itself with people that live there that are better equipped to understand the stories that they're hearing emerge from their communities, and help us make meaning of it so that we can see truly, like, what's the community value? What does it see its strengths as? What does it see its opportunities as? What are opportunities for us to make some improvements, and how do we know those improvements are making a difference? This is all an effort to involve the community in designing that, interpreting it, and helping decide what to do next as a result. And so that's what we're wanting to highlight today around Family Strong, is this sense-making, story collection, sense-making initiative that's going on there. So next slide, please. So story collection is meant to get a broad understanding of just like different patterns or experiences in the community that are related to people's well-being in the community, what maybe their perceptions or beliefs are around help seeking in the community, since this is a help seeking initiative. And we combine these stories with what I mentioned earlier, our local sense-making sessions, to actually help us make meaning of those stories, what's emerging from the community, and understand maybe how folks' values, perceptions are changing, and if that can be connected to some of the events, activities, strategies that are being implemented in the community, to know if they're having an impact, if you're actually seeing something from the community emerge to suggest that there's an impact. In terms of story collection, and what that looks like before sense-making sessions, it is an online survey tool. There is a QR code to it on this screen. Even though we're talking about Southeast Kansas, I'll put a plug for this a couple times. This is actually a statewide data collection effort. So regardless of where you are in the state, we're going to be doing these kinds of efforts and these kinds of community engagements throughout Kansas. So please feel free, and really we would be grateful and welcome you to share your own story about your community. So use that QR code, and also if this is something after this conversation that you find could be a benefit to your community, and you want to see more stories come from your community and have us come to your communities and help you do community sense making, we feel free to get in touch. You'll have our contact information, and we can equip you with materials to do story collection and future sense making. In terms of the tool itself, like I said, it's an online survey tool. Takes about 15 minutes to complete. It's open to anyone and everyone as long as they're 18 years and older. And it includes questions and prompts that are meant to like bring out what factors shape an individual's idea of the community. How do I feel about the community that I live in? A brief story about what it's like to live in this community, just kind of like a daily life experience, and then some reflections on what that story means to folks. And you're gonna see a little bit of a flavor of that in the next few slides as we move forward of how we're using this specifically in Southeast Kansas at the moment. This doesn't include personal identifying information. So of course we want to understand where the surveys are coming from, some demographics about that, some experiences folks might have as they're telling us their story that help us kind of ground and understand where those stories are coming from. But it's not going to ask for names, contact information, anything like that. So it's an anonymous survey on that front. Next slide, please. So if you were to take the survey and give us a story, you're led really early on in the survey to a survey prompt. And when I said earlier, like we're asking people to help us understand what daily life like might be in their community, we asked them to give us a simple story. Doesn't have to be paragraphs and pages, maybe just a few sentences. And the prompt specifically asks people to think about how it looks and feels for them and the community that they live in, and to tell us about a recent experience that you or your family had that helps show what life is typically like there. The brief story could be about a recent moment where they felt strong or thriving, or about a challenge they often encounter that makes it hard to get ahead, and just getting a brief understanding about what that experience is and the story that folks want to share. So again, thinking about yourselves, the communities you live in, maybe if you're service providers, the families or clients that you might be working with, it can be really profound to contribute to this and help us understand what life is like in the communities across Kansas. So that's the prompt. That's the basis, the major basis for the online tool and survey itself. And then, like I said, after we've collected a volume of stories and surveys, we actually take that data to community sense-making sessions. Instead of the researchers analyzing patterns and saying, this is what this means, or this is how we interpret it, we actually just bring the data to the communities and do some like creative facilitations to let communities be in kind of the driver's seat for how those findings are interpreted. That's the next slide. Thank you. So after we collect those stories, we're hosting these community sense-making sessions where we're really diving deep into what results from these surveys and these stories that we've collected and looking at various patterns. So we bring people to accessible areas in their communities. Again, have some fairly creative and engaging facilitation methods to get folks to help us understand what stories mean and the meaning we make out of them. And really the purpose of all of this is to establish what it's like and an understanding of what it's like to have a lived experience and needs in the community. Challenge any assumptions that there might be pre-existing about communities, about families, help us with more real-time information on what support services, resources, systems, just kind of what the perspective of families in the community are, and then ultimately spark real actionable ideas that the community can maybe take up next. So if we have this, if something emerges of like, this is a need in our community, or something that we want to change, or something that we want to act on, and we actually feel equipped to do it, this is a next wise action that we can take. And then we can continuously look at stories over time to see if the stories are indicative of those changes that we may be seeing or wanting to make. Next slide, please. So this is an example of a pattern of the stories that we have collected that have resulted from work that we're doing with Family Strong in Southeast Kansas. So everyone that takes the survey will give us a story, and then they'll answer some questions about that story. And this is one of those questions that you're seeing on the screen. Every one of these points in this triangle is a unique individual's story. It's a unique individual's responses to the survey that we take. So you can see roughly, like, I think it's about 30 stories that are collected within this particular triangle at this moment. And the question is basically prompting someone to say, based on the story you provided us, getting help depends on what? And it kind of gives you a chance to position your story within the triangle. So at the top, getting help depends on knowing the right people. On the bottom left, getting help depends on trying something new or different. And on the bottom right, getting help depends on advocating for myself. And you can see, at least in this community, generally how people position themselves on that particular question. When we go to community sense-making sessions, we look at some patterns, we identify some things that we noticed that emerged or jumped out at us, and then we take those patterns to the community and we have them help us make meaning out of it. So that cluster, or that kind of group of stories that circled in green there in the very center, those are people that said, getting help in my story depended on, maybe some combination of the three of those things that's hovering around the center, or it's not hard in one direction or another. So we were interested in the fact that there was a cluster that emerged there. And then we take that cluster to the community along with kind of a snapshot of a story that came from that cluster. And that's what you see on the screen here. So someone who positioned their story within the center point there that we've circled gave us this story. Young adults do not have enough support and resources in our community. My son is getting ready to turn 22. He has not attended college. One of the only avenues he has found for meeting others his age is by going to a bar, which he does not always want to drink, but that is the only area he has been able to identify where others hang out. He has made older friends through employment, but again, alcohol seems to be involved. He has a gym membership, but has not found many his age to identify with there. He often feels like online gaming is the only avenue for meeting others with similar interests, and therefore spends a majority of his time alone in his room. This creates some social isolation and leads him to have some anxiety of meeting others in person. Having a thriving community scene for young adults outside of college is greatly lacking and leads some to poor choices with the influence of alcohol or other drugs. Young adults need more recreational opportunities offered. So this gives you a sense, an idea of the very impactful, meaningful story that someone is giving us from this community. And also, if there was an element of seeking help or expanding social supports for young adults in this community, kind of how they would position it within this triangle. And these are the kinds of things that we would take to local communities instead of us saying this means you should have more things in place for young adults and us just like kind of imposing that from a research perspective. It's actually, what does this mean to you all? What is the next action that can be taken? Is this a value of the community? Is this something that you all see replicated as a pattern or something you want to address? But having that story behind it really kind of humanizes it in a way that makes people perk up to it and also want to say like, yes, this is reflective of things we're seeing. This is a real thing in our community, or not, if the community doesn't, the sense making doesn't result in that. Next slide, please. Quickly, this is another example of a pattern that we saw that we took the community. So in another question, we asked people when they thought about the story they provided us to think about, when I think about what's in my community, we need, at the top, we need more services and programs. At the bottom left, we need cheaper or free programs and services. At the bottom right, we need accessible services and programs. And again, you'll notice we identified a few emerging kind of clusters or groupings of stories that came from this group as a starting point to go to the community and say, hey, we're seeing a chunk of stories, if you will, that are showing up in the middle here with orange circle, or showing up in the bottom right here near accessible services and programs with that teal circle. And then as you read the stories themselves and dig into them in the community, you can get a sense of why people may have positioned themselves that way. So a story that came from the center cluster here, circled in orange. We had a tornado recently and an older couple's home was destroyed. Within just a few hours, a large group from one of the churches showed up to help with the cleanup. People were calling their family members to see how they could help. Churches and community members donated money to help. So again, an example of where that help maybe is emerging in the community, where some strengths are, some things to build upon. Bottom right, where we're saying where the stories are suggesting we need accessible services and programs. Rent is incredibly high in my area. I wanted to move to a new place where my daughters could have their own bedrooms that were a larger size. I ended up paying almost double my previous rent from $650 to $1,100. House is still small and old, but has some amenities like a cellar and a garage, but the house is just as old as the first one, really only marginally larger, and still has awful uneven floors. Rental prices just impossible to keep up with anymore. So again, there's a lot of rich things that can come from community stories. And these are the types of things that we would bring to communities to help make sense of what we do with it and where we go next with it. Which is the next slide around what results from going to the communities and doing these guided community sense-making sessions, and the patterns and stories that we would examine at those sessions. They result in what we refer to as, at least at this point, as next wise actions. And so resulting from some of the things that we've talked about today in Family Strong is wise actions that folks have suggested that the community may begin to act upon, that we can continue to monitor and see if those things are actually resulting in well-being or help seeking in the community. So things that have resulted in X wise actions from this work in Family Strong's case have resulted in creating more third spaces physically and online. So places where people can connect, find communities. The one was about young adults in the community and the struggle to have those spaces for young adults to connect. So you can see a connection there. Convening community partners to create an action plan on how are services transparent? Do services deliver on what the promise of the service is? Are they restoring trust? So, getting help depends on those different areas. Or is it accessible? Is it something that I can actually approach? Making sure providers are actually communicating how folks can access things and where to go for things. And then finally, holding public forums to educate lived experience in the community. So these are things that folks have suggested, real folks that live in Southeast Kansas to participate in these convenings have suggested need to be done in an effort to ensure that there's maximum well-being and support for help seeking in Southeast Kansas. So where we go from here, again, on some next steps, is truly starting to implement and supporting others to implement those next wise actions in the communities, doing it at a state level if it's necessary, helping, even though we're starting in the community and it's being generated from the community, if it's multi-system or there's macro systems that we can help make connections to and support. Those are important things, and why involving us and involving university partners matters. We're also continuing to collect stories. So again, another plug for if you want to share your own story from your community, this is something that is going out statewide and is live. It's not just restricted to Southeast Kansas, so feel free to share your stories widely, or even the point there, you could request postcards from us or social media materials so that you could spread it through your communities. If you thought this was an important effort to get stories from your communities, we can provide you those materials. And then we will continue to do ongoing sense-making sessions in Southeast Kansas, as well as different regions throughout the state, so that we can see what wise actions or needs might come from different regions that have different needs, different strengths, and different community values. So hoping to be able to use all of this to meaningfully engage communities, meaningfully engage people that have the lived experience that it affects them the most, and making that connection to these would be recommendations that would come from communities that decision makers could take up, knowing that they involve the communities as much as possible. Kayla, I'll leave it open if there's anything additional that you want to add to this before we wrap up. But that gives y'all a flair for at least one of the things that we're doing, data collection and community engagement wise with Family Strong.
Yes, thank you so much to Kayla and Jared for coming on and talking about these initiatives and what's going on in Kansas. I did not know much about either of these things, and I feel much more informed, and there's some exciting things going on in the state. If anybody has any questions, feel free to use the chat for Kayla or Jared, or come off mute if there's anything that you wanted to say. But if not, we will move into our next presentation. And you can always reach out to me and I can pass along any questions as well. So there's always that option. Not seeing anything in the chat and not seeing any raised hands or anyone coming off mute. So once again, thank you so much, Jared and Kayla, for being here today and sharing all of that wonderful information with us. We will move on to Sharon Field from the Kansas Child Care Training Opportunities, otherwise known as CASITO, to talk to us about the Individualized Professional Development Plan for Kansas early care and education professionals. Sharon, if you would like to come off mute, you can go ahead and get started.
Okay, thank you, Julia. I am Sharon Field. I am the Career Pathway Coordinator for CASITO, and I just wanted to give everybody a flavor for a new tool we have within our early childhood system. It's the Individualized Professional Development Plan for Kansas Early Care and Education Professionals, better known as the IPDP. This tool was made possible because of a coalition from the Workforce Development Advisory Group with input from direct service providers across the state. It's funded by the Kansas Department for Children and Families. This is a collaborative group led by CASITO and is made up of representatives from many agencies and programs across Kansas that have interest in early childhood care and education. So this tool was first introduced in 2022, and then it underwent some revisions in 2024 with support from the Workforce Advisory Group, along with feedback from the direct service providers themselves. So what is an IPDP? This is an individualized professional development plan. It's a customized path to reach professional growth. It's a tool that guides you through the process of reflection and awareness, and is strengths-based and based on your interests as well. It determines areas that you may benefit from additional focus. I want to emphasize that this is an individual professional development plan and not a plan for the program. So it's a plan for the individual teacher, professional working with the children, and you all yourselves can have a IPDP as well. So it's a 3-step process. You utilize a self-assessment tool, and then you go in and create your goal based on your self-assessment, along with some action planning. Go ahead. The first part is a self-assessment. Currently, we're using the Kansas Core Competencies self-assessment based on the newly revised Kansas Core Competencies. This is the recognized self-assessment in Kansas and for early childhood care and education professionals. The self-assessment can be accessed online or in print. It's also in English and Spanish. So once you go in and do your self-assessment, the one caveat with the self-assessment I will say is you do 1 or 2 domains. If you've looked at our Kansas Core Competencies, you'll know that there are 9 domains and a lot of competencies. So go in and do 1 or 2. And then you would create your goal statement. So this tool walks you through some reflective questions that result in a broad goal statement about your long-term expectation of what you would like to happen through your actions. It serves as a foundation for developing your outcomes. And then your goals should align with a statement of needs. So we walk you through the process in the tool. I didn't put the whole all the questions up here in our PowerPoint, but it is 6 questions that help the professional to focus on the why this goal and who it impacts. So the second step is really crucial in developing that goal or outcome. In this example, we have increased family involvement by hosting family events and all the steps and that would go along with it, earning my CDA by completing required coursework and demonstrating my knowledge and experience. And example 3 would be create opportunities for nature play and exploration by building more of a natural outdoor play area. So as we go further and you do a step 3, which would be creating your SMART action steps. We kept with the SMART framework in this. You'll note that there are different colors for different columns on here. Because within the IPDP guidebook, we have examples of what action verbs are, measurements, observable actions, and timeframes. So somebody who's not familiar with the tool could go into the guidebook and then follow along using those color codes, kind of like a formula that you could use to create your action steps. In this example, we use the increasing family involvement by hosting family events. The first step is for a professional to gain any kind of professional development opportunity that could help increase their skills and competence and confidence within, obtaining their goal. We also linked it to requesting some visits from a links to quality consultant because we know that PD is not just happening through courses, but it also happens through the coaching and mentoring relationships that a professional would have within the early childhood system. And then the rest of those steps are steps that would get you to your goal. Go ahead in the next slide. So again, here's where you see there is a place on the IPDP in which a professional can put the resources needed to obtain their goals, such as coaching and mentoring, enrolling maybe in a college course that focuses, from this example, on promoting family engagement or family partnerships. It also allows for those resources and materials that you might need to help support your progress, whether it's a scholarship to obtain the professional development that you would like to partake of, or whether it's, contacting a coach or a mentor to be able to hone in on those skills. We know that adding professional learning opportunities, higher education opportunities, coaching and mentoring is vital for our early childhood professionals to continue to grow in their skills and confidence and competence. And then lastly, I have an example of the completed IPDP. So whether you do this in the download in the booklet or online, you will have a result of a completed IPDP, and it looks just like this. And so you could see your overall goal, your steps, and your supports all in one place. This makes it easy for a professional to be able to outline their action plan, know what they need, and be able to check it off. I don't know about you, but I kind of like to check off action steps as I go along. So this just made it quick, easy, and simple on one page. To gain resources, we have it on our website. You'll see that on the Casito website, we have both downloadable for both the self-assessment and the goal statement and action plan. You can also fill it out online. It's an online form that you would just walk you through each of the steps. If you would like to have a guidebook in your hands, Casito does have both English and Spanish guidebooks printed. Reach out to us and we'll see how we can get you one as soon as possible. If you support direct care providers and you would like to use this in your own practice with the professionals that you're in contact with, please reach out to us. I'd be happy to drop off a box. We do have boxes of both the self-assessment and the IPDP guidebook. So just reach out and we'd be happy to do that. The next slide. Okay, so I wanted to just also give a little shout out, because if you're going through this process as a direct care provider and you're not connected to an agency or a coach or a mentor at this point in time, and you would like to have some one-on-one help filling out an IPDP, or you have questions about an IPDP, we now have career navigators who can support your individual growth. Their job is to guide you to finding your career aspirations, supporting your skills and your interests within the early childhood field. Part of what they do is career mapping, learning about peer learning opportunities, and all of the professional development that may be available to you in your area. This QR code will connect you to a booking page. You can connect with our career navigators. Chelsea Kuzmic and Casey Gormley. They are out there in internet land, and they will be happy to help you fill out your IPDP, guide you through the questions. It could seem overwhelming. We don't want this to be an overwhelming process for our professionals. We would like for this to be a tool that you use and become regular practice for those in our field. So please reach out. You can see them or my contact information if you would like further information for your staff. Is on the next slide. If you would like to order some of the physical copies, please reach out to me on my email. I'd be happy to find a way to get them to you. It may just be a drop off, but we'd be happy to help in any way possible. Thank you, Julia, for allowing me to highlight a tool that has come a long way in the last couple of years.
Yes, I appreciate that so much, Sharon. I know that we had IPDP as one of the presentations a few years ago, and I know that things have changed since then, so we appreciate the update. Thank you so much. I am just going to move it right along into our early childhood systems updates. Just a few events to share with y'all before we wrap up today. So first being the Community Self-Assessment Toolkit. There is a training coming up if anybody is interested. The Kansas Commerce invites community leaders to a virtual training on how to use the new Community Self-Assessment Toolkit, which is going to be a valuable resource that's designed to help identify community needs and opportunities for future grant funding. So this training will guide the participants through the toolkit, which includes resources for completing an asset inventory, conducting a community survey, and hosting a community meeting. Each of these tools gathers information that will help build a community action plan that will drive meaningful change and ultimately assists you to craft a successful grant application. So that training is available on Thursday, February 20th from 1 to 2:30 p.m. And then I'm going to have Bree drop the link for the registration for that into the chat. So very interesting, awesome community self-assessment toolkit. It's going to help identify your community needs and then show opportunities for future grant funding. Next is the 4th Annual Kansas Early Childhood Governance Summit. Lindsay, if you've got the time, if you want to pop off mute and give us the rundown for that. Lindsay is one of our backbone supports for the Early Childhood Recommendations Panel and has put a lot of work into the 4th Annual Kansas Early Childhood Governance Summit.
Thanks, Julia. Hi, everyone. Lindsay O'Ryan here. One of our, also work at the Center for Public Partnerships and Research. I help to support coordination for our Early Childhood Recommendations Panel, as Julia mentioned. And we're really excited next Friday, February 21st, to host our 4th Annual Early Childhood Governance Summit. This is a virtual connection opportunity held during one of our normally scheduled panel meetings. And we invite a wide variety of early childhood governance groups and organizations to come together and share about accomplishments and goals as we look at building up the early childhood system in Kansas. So this is a great opportunity to hear about what our colleagues across the state are working on, look for connections, elevate the great work that is happening, and continue to work together in our goals for our early childhood strategic plan. On the slide, and I think Bree will share in the chat as well, you can find the link to view this summit on the Children's Cabinet YouTube channel. And there's also a really lovely summary of our event from last year that shows the groups that attended, their accomplishments, their goals, all of that information, as well as beautiful graphic recordings from my colleague, Sarah O'Keefe. So hope to have you join and watch. If you can't make it live, we will save the recording and that'll be available online as well. Thanks so much for the time.
Thank you, Lindsay. Yes, so if you would like to watch that governance summit, please log into the Children's Cabinet YouTube channel next Friday at 9 a.m. And then the last event that I will go through today is the childcare licensing roundtables that are being held across the state. This one is for South Central Kansas. So KDHE, the Kansas Department of Health and Environment, as well as their childcare systems improvement team, are holding these roundtable discussions to give Kansans the opportunity to share their experiences with childcare in their particular regions. So if you are a childcare professional or a caregiver for a young child, or just have some thoughts and opinions on childcare within your region, you are more than welcome to attend this event. It is in person, and that's going to be held a month from today on Wednesday, March 12th. From 6:30 to 8 p.m., hoping to give people the opportunity to come after work. And that is going to be held at the Child Start in Wichita, Kansas. As I said, the event is open to the public and all are welcome. So Bree will put that link in the chat for you for registration. They just want to have an idea of how many people might be there beforehand. So registering is important. And then if you have any questions about these childcare licensing regional roundtables, you can email another one of my colleagues, Megan Kluth, at mkluth@ku.edu. All right, and then just some of our reminders and next steps, as Lindsay just told us, in place of the February recommendations panel, they will be hosting the 4th annual Kansas Early Childhood Governance Summit from 9 a.m. to 11:30 on Friday, February 21st. And like she said, it will be live streamed on the YouTube channel, but the recording will also be available for you at any time after next Friday. Our next early childhood systems building webinar will be on Wednesday, March 12th from 12 to 1. And next month's is going to be a little interesting. We're kind of doing something different for the webinar in March. We are going to be hosting a panel-like discussion between childcare licensing and also some partners that work throughout our unified school districts in Kansas. So basically working together to try to eliminate any childcare barriers that exist for school districts that are maybe trying to put a childcare center within their building. Just a lot of great discussion that will be happening at that meeting in March. So please join us on Wednesday, March 12th for our next systems building webinar for that panel between childcare licensing and some representatives from unified school districts across the state. And then our next children's cabinet meeting, I know that they had one, I believe just last week. So the next one is not until Friday, April 4th from 9 to noon. And again, as always, you can find these meetings, the recordings typically on the Children's Cabinet YouTube channel, or they are live streamed on that channel as well. So in order to stay up to date with us, sign up for that All In for Kansas Kids e-newsletter. You'll receive that weekly on typically Monday, but sometimes Tuesday, just to get some updates and know what's going on. You can follow us on Twitter, also known as X, and you can subscribe to that Children's Cabinet YouTube channel. And I know that Bree is furiously trying to add all of those links into the chat right now. So those are there for you. And if anybody has anything for me, I think I see a hand raised. Chris, I don't know if you had a question. But yeah, thank you everyone for joining us today. That is all that we have for you.